Hi, my name is Christopher Menschner. I have the privilege of serving as the Assistant Commissioner for the Division of HIV, STD, and TB within the New Jersey Department of Health.
So hey, I'm Kathy O'Brien. I'm the Executive Director at Hyacinth AIDS Foundation, and I was co-chair of the state's task force to end the HIV epidemic.
Hi, I'm Sal Sissi, and I'm the Outreach Coordinator of the Prevention Resource Network in Asbury Park.
Hi, my name is Kira Burstecker, and I am the Vice Chair of the New Jersey HIV Planning Group.
I'm Axel Torres Marrero. I'm the Senior Director of Policy at Hyacinth AIDS Foundation.
Hi, my name is Gary Paul Wright, and I'm the Executive Director of the African American Office of Gay Concerns.
Now is the time to end the HIV epidemic in New Jersey for a number of reasons. One, we have biomedical interventions, PrEP and U equals U, that can get us to ending the epidemic. Two, stakeholders are very much willing and ready and have been at the table with us during our entire time working on this issue to develop strategies to end the epidemic. Third, we have the right leadership in place to help us get there, both at the Department of Health and at the top levels of the state in the form of Governor Murphy and his administration.
I think the task force was a great opportunity for various members of the community to come together and work on this plan. We had clinicians, we had community activists, we had researchers, we had representation from the HIV nonprofits around the state.
For the first time in decades, we can end HIV without a cure, without a vaccine, but by using biomedical interventions to stop the transmission.
We talked a lot about what it meant for the communities who are most vulnerable to an HIV infection. We spent a lot of time talking about prevention with Black, young, gay, male, and transgender women. We spent a lot of time talking about harm reduction and what it means for people who inject drugs. And we spent a lot of time making sure that really everybody has access to the same opportunities for medications, for prevention, and for access to services.
This is a plan that takes into account the needs of marginalized people, especially young LGBTQ people, women of color, and drug users.
If we are going to end the epidemic in New Jersey, we must all embrace the prevention strategies that have proven effective and not only stopping the spread of HIV, but also hepatitis C. That includes all harm reduction prevention methods, including syringe exchange, harm reduction centers.
Throughout the plan, we look at stigma and cultural competency as important factors in how we will end HIV.
It also includes taking a good look at all existing state statutes related to HIV and AIDS. That includes the criminalization statute that in many ways adds stigma to the work that we're already trying to do.
You know, we're trying to end the epidemic here in New Jersey by 2025, and one of the major things that we want to do is to get people tested. I don't care whether you're gay, you're straight, you're trans, you need to know your status.
Our End the Epidemic plan talks about increasing the availability of testing. We talk about the importance of eliminating barriers, such as stigma, and the community's perception about what it's like to test and who should and shouldn't be testing. We also talk about testing in an environment that's sex positive and culturally supportive.
We know the winning formula. The winning formula to ending AIDS, ending the epidemic, is twofold. It's to find the individuals who are positive, make sure that they have unrestricted access to care and treatment, that they remain adherent to their medication, and that they therefore are undetectable and uninfectious.
There are places all over the state of New Jersey to go get tested. They're quick, it's rapid, and you can find your results in about 20 minutes. Let us know where you are in this epidemic. We can help you, we can get you treatment, we can get you on PrEP, we can do whatever needs to be done, but you gotta get tested.
On the care and treatment side, it means removing all of the barriers to care and treatment. At Medicaid, which provides about 80% of the care for people living with HIV and AIDS, is to make sure that prior authorizations are removed, step therapy is removed, and that the HIV medications have protected status under Medicaid.
Together, we can reduce the community viral load by maintaining our appointments and communicating our needs with each other. This is supported by community health workers, providers, and all the community at large. U equals U. Undetectable equals untransmittable. This means as long as your healthcare goals are being communicated with your provider, you can get there and we can get there together.
Ending the HIV epidemic in New Jersey is very much within our grasp and is a realistic goal that we can accomplish, that we will accomplish by 2025. ending the HIV epidemic in New Jersey is very much within our grasp and is a realistic goal that we can accomplish, that we will accomplish by 2025.